My name is Dr. Reba Slifka, and I'm here today to answer some questions about doing blood work for your pet, such as why your vet might recommend it for your dogs and cats, the importance of it, and what you can learn from doing blood work. The importance is that the blood work can kind of show you more than what you can see from the outside. It gives you kind of an inside look of what's going on, so you can kind of learn about more what is the cause of your illness for your pet. So the question is, what types of different lab work is there? And there's actually a very large variety. Most veterinary clinics, they'll have the basic lab work that you can perform in-house, such as a CBC, and that checks your blood cells, including your red blood cells, checking for anemia, your white blood cells, checking for infection, and then your platelets, which are your clotting cells. And then another important component of blood work is the chemistry, and this checks usually your organ values, your blood sugar, your electrolytes, and your protein values. And then another common thing we test for is thyroid. This measures your thyroid hormone to tell if you have an underactive or overactive thyroid. So most veterinary clinics can run these tests in-house, but there's a lot more blood work. For your average pet, like a healthy pet such as your dog or cat, I do recommend once a year because over the course of the year things can definitely change. So doing it once a year just gives you a good way to just kind of follow their normal values and see if anything is starting to increase, any values are starting to creep up or creep down. However, some pets might need it more often, such as pets that are on long-term medications or pets that have had abnormalities previously in the blood work. Those we might like to check more often, such as every 3 to 6 months. If they are sick and then you come in and repeat blood work because they're not feeling well, then you can compare it to what they normally are, and that can kind of give you some guidance as to whether these changes in their blood work are actually due to them just a normal abnormality for them, or because they're sick and there's something underlying that needs to be addressed. But if you can kind of find something early, sometimes you can intervene earlier, and that way whatever process you might find on the blood work, such as kidney disease, you might be able to slow the progression. It can really help save costs for you, it can help save a pet's life, and it can help prolong their life.